Welcome to our Research, Reflection and Practices Forum. It's actually our learning platform, but you're a special invitee because we just had our, monthly guest lecture. So, but since you're here and Dr. Benjamin Schwab is a Fulbright scholar and attached to the University of Pennsylvania, to the Department of Agricultural Economics and Business Management. So since he will be leaving very soon, so we thought of getting his expertise and sharing his ideas with us and see where we can go from here. So let me give a little brief introduction to him. So he's attached to the University of Kansas State University as Associate Professor of Agricultural Economics, as well as the chair of the International Section of the Agricultural and Applied Economics Association. He also previously worked for as a Associate Research Fellow at the International Food Policy Research Institute. His research focuses mainly on health and nutrition, international food assistance, health insurance, the gender wage gap, marriage markets, connections between mental health, stress and economic decision-making, and the relationship between agricultural productivity and cash transfer programs. He has worked widely in East Africa and in the Middle East. He has a number of peer-reviewed articles in leading disciplinary journals, such as the American Journal of Agricultural Economics, Journal of Health Economics, and Journal of Development Studies, as well as multidisciplinary outlets like the Biological Conservation and Ecological Economics. So his expertise is quite, I understand, is very multidisciplinary within economics. And his bachelor's arts degree is from the Rutgers University, and it's in economics and Middle Eastern studies, and has a MA and a PhD from the University of Wisconsin in Madison in agricultural and applied economics. So I warmly welcome you today and to talk to us on an overview of causal inference methods and a discussion of its implications for policy research and program evolution in Sri Lanka. So over to you, Dr. Shiva.
Hi, everyone. Thanks for having me. It's a pleasure to be here. I assume the previous guest lecture you referred to was Derek.
Yes.
Yeah, so great to be able to follow him. He's terrific. We actually worked together at IFPRI, and so it's been nice that he's been able to actually, as a coincidence, that he's working here in Sri Lanka and getting involved with the IFPRI projects. In one of the things that, as you were, discussing some of my research record, one of the things that kind of unites some of the topics I work on is obviously a focus on livelihoods, especially rural livelihoods and poverty, and the kind of key components like health and nutrition for those individuals, and also a focus on methodology. So having a kind of sound methodological approaches, which kind of allows me to work in kind of several different areas. And that's actually what I'm going to talk about today. I'm going to spend maybe 15-20 minutes just going through kind of a very non-technical overview of some of the basic kind of causal inference methods that we use for a lot of policy analysis, poverty analysis, impact evaluations, just the kind of basic concepts. I'm sure we have kind of a diverse technical background. So for some people, I apologize if this is a review, but certainly I think I want to talk about it just as a way of introducing and thinking about, potential research opportunities involving current policy questions, current, controversies, topics of interest, and things that we can kind of think about and plan for future research. And I think, especially for research organizations like SIPA that are kind of focused on, policy relevant research. These kinds of methodologies and topics are obviously quite germane and give a great opportunity for collaborations with academics and other researchers both inside of Sri Lanka and outside. Okay, so I should note that I have been working with at University of Peradeniya for about the last 4 months, and I will be leaving the country now, but I will hopefully remain as a visiting scholar there. So one of my goals as a visiting Fulbright fellow in Sri Lanka is to kind of maintain ties and have this be the start of a longer term collaboration. All right, so let me talk a little bit about the overview of causal inference and impact evaluation. So the kind of objective, the canonical objective of what we call impact evaluation is to think about the causal impact of some kind of intervention or outcome on some outcome. So we're trying to think, okay, there's a program happened, an intervention happened, a policy was implemented. And so how did that cause a difference in an outcome that we're interested? So if we gave out free bed nets, how did that cause an increase or decrease in malaria incidence? If we increase the amount of ag extension work that occurred in a particular area, how did that change the adoption of fertilizer among farmers who were affected? How did a cash grant affect the consumption of fruits and vegetables? So we're very much interested in these X cause Y kind of relationships. And oftentimes I want to just briefly mention this, but that like sometimes debates about policy analysis really do come down to arguments about causality underlying certain policies. And so understanding, having a good answer for these kinds of questions ends up becoming something of interest, both academically and also practically speaking. So just a quick note on evaluation. So the term evaluation kind of gets thrown around a lot. Oftentimes when programs are implemented, implementers will say, we're doing an evaluation. And the evaluation is more a process evaluation. Okay, we did this extension program, and we checked. We had GPS on the phones. The extension agents went to the field and they met with farmers as far as we can tell, right? So the program worked in that sense. And that's actually important, right? That's kind of a necessary condition, right? If we want to know if extension agents improved agricultural productivity, certainly a necessary condition is, well, did they actually show up for work, all that thing. So it's important, process value important, but it doesn't actually tell us much about causal impacts of the outcomes we're of interest in. And that's what the kind of the domain of impact evaluation is. And the reason I point this out is because the implementers are oftentimes interested in both, but certainly the incentives for implementers sometimes align with showing process evaluation outcomes, right? We were hired to do X and we did X. That's really important for them. And so, but as researchers and people interested in policy, right, we're not just concerned with, did you fulfill the contractual obligations of your contract, but what was the actual, what happened? Did this achieve outcomes that we wanted? And in order to do that, we need to answer what we call this counterfactual question. This is the kind of the key terminology that we come back to again and again in causal inference. And a good kind of summary of this counterfactual question in the context of a anti-poverty program would be, what would the participant look like if she hadn't received the program? If we can answer that, then we can answer the difference, right, that the program made. So graphically, right, we kind of think about this idea, okay, we have an outcome, it's changing over time, right? We did some intervention. And if the yellow line is the outcome with the intervention, The orange line we think of as the kind of the counterfactual change, right? So we see that in this sense, there was a kind of a positive sloping change over time. So sometimes, right, incomes just increase over time in a place, yields increase over time because there's generic, we call secular trends. But the intervention itself made a change in this case by bringing that person from the orange line to the yellow line, right? And so we can measure the difference. If we look at the difference, we say, okay, well, you would have, followed that orange line slope, and then, instead we see you at this yellow dot at the end. The difference in your outcomes is the impact. And that is conceptually what we're trying to do. But we have a problem, which is that this is impossible to observe. So this is the big issue, right? This is what we call the missing counterfactual. Once I give someone an intervention or a treatment, as the literature calls it, they can no longer be untreated, right? The second that that person gets the transfer, right, we cannot observe what would have happened to them, that same exact person, had they not gotten the transfer. Absent some kind of interdimensional time travel or something like that. So science fiction likes to kind of explore missing counterfactual questions a lot. It's kind of a fun thing. What would have happened if this happened? But in real life, we can't really do this, right? It's actually just a metaphysical impossibility. So the idea of like impact evaluation is like, how do we solve the problem of the missing counterfactual? Right, that's really at its heart, the problem of causal inference and impact evaluation. So what we're really trying to do is we want to nail down causality. A change in X causes a change in Y, and we want to distinguish this from kind of basic correlation. So, okay. We've said this is impossible to do. How do we do it then? All right, well, if we have so David Evans, who used to work at the World Bank, I saw him once use these kind of cartoon characters to explain this, and I said, this is perfect. So I use this in my classes. So I asked him if I could steal it from him, and he let me. So I use this in my classes at the university, and I think it's kind of a good thought experiment. Because what if we could just clone people and clone their environment perfectly, right? So we have these characters, we clone them exactly. And there's a very important thing about these clones. And this is the key problem. They're identical on the outside, but they're also identical on the inside. So in this case, they love to take up new health interventions, right? So they're identical in ways the researcher can observe, but they're also identical in ways that we can't observe, right? That's why this is a perfect experiment, and why we have trouble in the real world, because there are things that we can observe about people and we can kind of make them equal observably, but we have problems if there's unobservable difference and we try to compare groups, right? And so if we have Cami and Tammy and they're perfectly identical, and we do this perfect experiment where someone's sleeping under a bed net and someone's not at the same exact time in the same exact place, right? We can come back and one of them's sick, one of them's not. We can say, well, good thing they had the bed net. Tammy was protected from malaria. She's playing on the slide. Cammy's sick, right? Bed nets cause a decrease in malaria, right? Only because they're absolutely identical. Right? This is tough, right? This is a tough thing because, again, we don't have a cloning machine, we don't have a time machine. So all these kind of perfect things that I'm kind of proposing, we don't have these in practice, but we do have some tools, right? And so it's important to think about what we're trying to recover, which is really what we want is we want a Cami and Tammy, we want a pair, we want two groups that are identical, at least on average, inside and out, right? This is, again, perfect experiment. Because if we can do that, right, then we can just look at difference in outcomes and we can attribute them to the treatment or the intervention. Oftentimes, in policy analysis, we have, and this is another term I stole from Dave Evidence because I like that it's very euphemistic, which is what he called room for improvement control groups. So he's trying to be kind of charitable here. But the idea is we can say, oftentimes policy analysis is not, we don't have the perfect experiment. We don't have this great kind of appropriate control group. And so people are using comparisons that, right, are not ideal. And so let's just, I want to briefly talk about them because that helps us kind of fix ideas about what we can do. And these are before after comparisons or the participant non-participant comparison. So the before after is, okay, well, you know, Cami slept in the bed without a bed net, then she did. And now if I compare before and after over the same 6 months versus 6 months, malaria incidence seems to decrease. If we use this, we can say, okay, yeah, bed nets helped, right? They decreased malaria incidence by, you know, 4 over 6 months. Right. The problem is, for example, in this case, the reason why we're using it in a kind of appropriate for Sri Lanka in the sense of we don't have malaria, but we have dengue here, and we know that that's seasonal, right? Malaria is also seasonal, right? If she happened to be, we can imagine, let's say the bed net was a dud, it didn't work at all. You might have the same exact pattern, right? If when she wasn't under the bed net, it was the rainy season, and when she was, it was the dry season, right? So something like that, right? So we know that when we just compare before and after, there might be a lot of things that are changing before and after, and so that can be difficult. We have to make these assumptions, right, that, okay, all the conditions before and after would have been the exact same, and that's a strong assumption. Right? Maybe it was the same season, we control for that, but the household had put in like window screens. Right. So the issue is that especially we might not be able to observe all the other things that are changing at the same time that the intervention is occurring. So before and after, sometimes it's really good to know before and after. It doesn't mean we should just forget about knowing what happens before and after, but it may not be sufficient. So there's some famous examples in the literature of, you know, cash transfer programs showing if you measure before and after, cash recipients seem to have like a decrease in their expenditure, but the issue was there was a big shock. Coffee prices went down in Nicaragua, and actually when you compared them to people who didn't get the transfer, their decrease was much lower. So, right, we have this, we can't reason just from the before after trends. The other big kind of room for improvement group that we talk about is this participants, non-participants, right? Again, if we think about extension visits and maybe like new seed adoption or something like that, right? We can say, okay, well, we had a field school, some farmers attended, some didn't attend, we measured their outcomes, and, you know, the yields were higher among the group that attended, right? The issue is that, right, what else could possibly happen to be happening here, right? We may have some other potential issues. I'm gonna skip through this here. There might be other factors, right? So it could be that, for example, the extension visits did cause like an actual change, but maybe the difference in the groups is attributable to something else we like to call selection bias. So selection bias monster, I always tell my students. So, you know, what could that be in the context of farmer field schools or extension visits? You know, this is something where, you know, if you show up, like, just like maybe here, who's showing up for the training programs that you have, people that are really willing to adopt new technologies, that are extremely interested in investing in new resources, that have the capital to take advantage of new technologies that extension visits might introduce. So if we think about the two groups, those who kind of show up for the field school and those who don't, right, it's actually would be a kind of heroic assumption to believe that, right, those two groups would be identical on average, even without the training program. And so that's what makes this incredibly different. So if we observe some difference in outcomes, it's extremely difficult to say, well, what's the difference that was made by the training program and what's the difference that was made by this selection bias problem. So again, we have this kind of general issue. We have before, after comparisons are tough. Participant, non-participants are comparisons are tough. Importantly, with selection bias, one of the big issues is that sometimes we can go a long way towards eliminating selection bias by looking at observable factors, right? Incomes, education. As we collect data, we can do that usually, and sometimes we can control for those kinds of things, right? But oftentimes for things like, for example, who's going to show up to the, we're thinking about potential outcome differences. And those might not be just things that we can observe, right? It may have to do with ability and attitudes and initiative and this kind of latent potential for adopting new technologies. And those are all things which both impact your likelihood of receiving the treatment as well as impact the likelihood of having a higher or lower outcome, right? And so when we have those factors that hit both of those things, then we have an issue when we kind of compare the two groups. All right. So what can we do? I've laid out all the problems. So the point of here is to kind of just talk briefly about like, okay, so what are the kind of ways that people are working on solving this program, this kind of missing counterfactual problem? What kind of methodologies are useful, and what do those entail? And so I'll just briefly talk about something that you've all, I'm sure, heard of, which is the randomized experimental design, RCTs, randomized control trials. And so you can solve this problem by making the selection rule random. All right, so whether you get the intervention or not is a coin flip. What you're doing here is you're breaking the link between the outcome and your kind of selection into treatment. Right. There's no capacity for a farmer, for example, to sort into being at the field school or not, right? You show up randomly to people's door and you give them the training. Some people randomly are picked not to, and you compare the outcomes. And so you're limiting, right, the capacity for, right, only the experimental farmers to show up, or only the experimental farmers to receive the treatment. Okay. That's at the basic level a way of solving this counterfactual problem, because on average, the two groups, the only thing that should be different between them is the selection rule, and the selection rule is a coin flip. So on average, they should be identical, right? So that's the theoretical justification. And then we can just look at the outcomes and the differences due to the treatment, because again, these groups should be identical on average. I want to just kind of talk about what is entailed by the RCT. So in theory, very kind of easy to grasp. This is kind of the canonical, like, scientific method in some ways, even beyond just economics and social science. But the main issue here is that this means that actually the implementation of the program follows a kind of a research assignment rule, evaluation rule, right? So that means design of the program and design of the evaluation are kind of happening at the same time. So evaluation is in essence before implementation. And that's oftentimes like not the way usually things are done, right? Someone's implemented a program and then they come to the economist and say, can you evaluate this for me? Well, this can be a tough thing, right? Because really what you would want to say is, yeah, I could evaluate it. Go back in time and do your program, but assign it randomly, and then I could look at the outcomes, right? So, but what that also means is thinking about, like, proactively about kind of the idea of what kind of policy questions or debates or kind of implementing partners, what are they going to do? And how from the beginning can we integrate kind of evaluation design and research, right? If, this implementation, this policy is supposed to come with evaluation, then it should ideally come with a evaluation design that happens before. right? So this is obviously a challenge, right? This, if this was easy, right, we would just be doing this all the time. But I think this is obviously from the kind of perspective of both implementers who are kind of responsible for following some kind of plan, but also from the perspective of people who are interested in the policy research side, being proactive in terms of, okay, this is something we're going to do. This is something we need to do research on. Well, what can we do on the kind of implementation side to make sure these are designed in a way that makes these amenable to research? Quickly, I'll just say that oftentimes one of the knocks on RCTs and randomization is that, like, there's this idea that you're denying people, like, oh, you're like actually omitting. We could have given everyone the training, but the economists told us we can't, so sorry. This doesn't actually have to be the case, and typically what we're always talking about is, like, the program almost always has constraints built in, right? How many programs are literally universal and literally will all happen at the exact same time in every single place, right? So there's typically budget constraints. So, okay, we're only going to be working in 2 districts. Okay, well, or we're only going to be working with 1,000 households or 2,000 households. Well, this means that the idea being like, okay, well, if you're working on 1,000 households, if we choose 2,000 households as to be eligible, right, then we can randomly assign the 1,000 households, and we're not denying anybody anything, right? We're just making the assignment rule random. Sometimes this will be built into the program, right? Oh, the program only has a capacity to kind of operate first in a few places. It's going to be universal, but the first year we're going to do a pilot, and then the second year we'll expand to another location, and the third year in another location, right? Again, you can exploit that in order to do the analysis. So, okay, well, oftentimes implementers are like, oh, I know this place, I work there all the time, so they're going to be the pilot, right? Well, the place that they work and love to work in, is not usually typical. It's oftentimes a place that, okay, they always receive benefits, or they're always they literally choose them because they have the highest potential for impacts, right? Well, that can be an issue if we want to compare those to other groups. So, okay, if it's going to be 3 areas getting it the first couple years, right? Can we choose those 3 areas randomly? And again, this is not, you're working within the existing constraints of the program implementation, right? You're not, but you're trying to make the kind of evaluation design so that the kind of assignment rule is easier to manage from an evaluation perspective. One other, kind of discussion about this is all right, well, if you're choosing things by coin flip, is that good? Is there what? So it depends on the kind of the context, but sometimes, right, this is a fair way to do it. And so there's been lots of evaluations, for example, for educational programs, like in the US, where you have schools that are kind of oversubscribed, like these charter schools. And so what they do is they have a lottery for individuals. Now, from an economist perspective, a lottery is great, right? This is random. So you have a bunch of people who are identical in the sense that they all want their kids to get into this school. So you don't have to worry about the selection into the school or not. But randomly, some will get it and some won't, just because the school is capacity constrained. So if we actually want to know the impact of attending these highly sought after schools, we can compare the group that entered the lottery and got in versus the group that entered the lottery and didn't, because again, the only difference between them is this, this lottery selection. And so there's a sense that oftentimes the way that the treatment is allocated, if it's going to be done fairly, is oftentimes essentially a random rule anyway. It's not to say that there is no ethical concerns with doing RCTs. There are quite a bit. This idea is we shouldn't be doing programs where the alternative is spending money on something we know doesn't work just for the sake of the RCT, like in irrigation, somebody gets irrigation and somebody gets a bunch of people we hire to do a rain dance. But so it's not that this is a kind of easy. Any RCT must by definition be ethical, but I think I just want to point out that it doesn't necessarily mean, oh, we're doing an RCT, therefore we're denying people something, right? I worked on one in Yemen where we actually didn't have a classic control group. We just compared a group getting cash transfers and a group to getting an equal value food basket, right? So the idea was thinking about which kind of modality was the one that would kind of increase dietary diversity, caloric consumption the most, right? So WFP was working on these experiments. And so they had enough money to give to every eligible person in these two districts. So there was no scope, right, ethically for saying, no, could you have a group that was control group that doesn't get anything? It would be nice, you know, from a research perspective, it would be good not just to talk about relative effects, but also absolute effects. Well, they didn't. So we did it just looking at these relative effects. But again, it gave us a lot more, right? Doing that was much more beneficial than, looking around the world and trying to compare places that got cash versus places that got food, because those places aren't necessarily going to be kind of all, ceteris paribus equal. So we talked about staggered designs. I'm going to skip this. So in terms of this kind of design, right, we even within a program, right, we might say, okay, well, listen, there's a group for like a anti-poverty program, safety net program, right, that it's got to be universal, right? We're going to reach every single person. But we're not going to be, and there's a group that's going to be excluded because they're certainly not within the kind of targeting criteria. We can only, within this middle group, right, we may only be able to reach 50% of those group. And so again, you can essentially do your experiment among the moderately vulnerable population here. So this brings me actually to the other discussion about randomized controlled trials, which is that what are the effects, the differences in outcome, what are they relevant for, right? If we did this program and we compared the outcomes between the group that randomly received the program and randomly didn't, right, the effects would be relevant for the moderately vulnerable population, right? We wouldn't really be able to say anything by definition about what would happen if you gave this program to the other groups, right? So this is oftentimes, again, discussed in the context of randomized control trials as the problem of external validity versus internal validity, right? So there's no magical kind of wand that makes it saying that if you did an RCT among moderately vulnerable population in Sri Lanka, that you will get the same impact that if you did the exact same program among orphans in Kenya, right? It's a different population. There's no magic wand that says that the effects are the same. This is not just an issue, of course, for RCTs, but for a lot of impact evaluation using other methods in general, but it's important to keep in mind. Quickly, briefly, that when we think about doing these randomized control trials, we have to think of the unit of randomization. Is it going to be at the individual or household level, right? So you can think of within a village, like half the households get something, half don't. Or is it going to be at the cluster level, at a clinic level, if it's a health intervention community level? So half the villages get something, half don't, as a basic. There are many reasons why one design might be chosen over the other. Many of them are practical. Sometimes doing randomization at the individual level is politically infeasible in the sense that, why did my neighbor get something and I didn't? Or why did my neighbor get package A instead of package B, right? And so it can be difficult to do. It can be difficult to kind of randomize within settings sometimes. So just on a practical level, there's also the kind of theoretical problem of spillovers, and what we call the stable unit treatment value assumption, which is essentially that you essentially don't want the treated unit of any one group to influence another. So we can think about like direct spillovers, like, oh, I got a food basket and I just gave half of it to my neighbor because I got something and I want to be generous. And then so if you go back to them and you measure the outcomes and they're the exact same, you might conclude, oh, food didn't help anyone because they had the exact same outcomes. But actually the issue was they were just sharing. So you can have direct spillovers. And so that all the kind of the analysis of difference in outcomes, I can just look at the differences, all that breaks down when you have this stable unit Sutpha assumption isn't satisfied. So sometimes that means we want to do the assignment at the village level. So there's less ability for spillovers to happen, right? Everyone in the household, in the village gets the same treatment status. So we're not necessarily as worried about these kinds of spillover effects. Spillover effects can also be subtle or indirect as well. So price effects from cash transfer programs, herd immunity from vaccine campaigns. So those are also issues. I'm going to skip the kind of technical issues about the design typologies and things like that. I will just say quickly that the biggest difference, practical difference, when implementing these issues is that is a power and sampling size issue. So when we think about doing these kind of randomized control trials and analyses, we need to be careful about statistical power. Basically, do we have enough sample size? Do we have enough variation to be confident that we can kind of tell the difference statistically between the two groups? So if we have these different point estimates and outcomes, how sure are we that the difference is from the program and not by chance? So the classic kind of statistical inference problem. If we are doing village level differences, right, and we have like 4 villages and 2 of them are treatment, 2 of them are control, and within each village we sample 100 households, and so we have a total sample size of 400. We'd say, oh, that's pretty good, 400. The issue is our effective degrees of freedom is essentially 4. Really, because the assignment is happening at the village level, right? The difference is that we can actually, the kind of variation that we can actually exploit is only happening at the aggregate level. And so effectively, right, the number of treated and untreated clusters when we do this cluster sampling is the kind of the limitation on our kind of statistical power. And as a result, right, cluster randomized trials, which can oftentimes be much less vulnerable to the spillover issues, on the flip side, they sometimes cost more because you need to have many more places involved, right? Whereas if you're doing individual randomization, right, it's, you can have a sample size of where the kind of number of actual households is actually corresponding to your effective degrees of freedom. So in general, we got to think about timelines, and we got to think about kind of the expense of doing these randomized control trials. So we can again talk about that during the discussion. I will just mention 2 other things quite briefly, which is difference in difference designs and regression discontinuity. So when we think especially about policy analysis, probably the most common methodological approach you'll see in like a paper that purports to have some causal estimate of the impact of a policy or program is going to be difference in differences. The idea is we can have, if there's at least kind of 2 dimensions of program eligibility that we can exploit the variation of, like time and place, then we can use those 2 dimensions to kind of cancel out the things that are different between the 2 groups and think about the impact of the program in that way. So visually kind of looks like this, where we say, okay, The treatment and control groups, they're different, right? They're different. I'm not going to try to argue that that these two groups are the same. We have like one group of farmers and another group of farmers. Some showed up, some didn't. Right? They're just different farmers, right? Well, if I use the difference, if I know that baseline difference, like the pre-program difference in their outcomes, and then I look at the post-treatment difference in their outcomes, and I subtract off the baseline difference from the end line difference, then I might be able to say the difference in the difference is the actual effect of the program. Okay, that's the basic idea behind differences and differences. Now, if you're essentially using like a change, the change in the control group as the kind of counterfactual change that you would have observed had the treatment group not gotten the treatment. Right, so this is a very common design. It's very easy to see. This is what we call a 2-by-2 case, where we have two groups, two time periods. What do we need in order to do these? Well, we need to assume parallel trends. We basically need to assume that, yes, in fact, the change that would have occurred in the treatment group is the same change that did occur in the control group. So trends between the two groups are the same. And is this a plausible assumption? And the answer kind of is, it depends. Depends on the time lag between the two groups, right? So the time measurement, right? If we're talking about like, okay, differences in, I don't know why I'm picking this example, but sort of like blood sugar changes after eating cake, like between groups that do and didn't have, they go, well, we know that maybe the two groups that went and had the cake might be different, but if we looked at the differences, if we took a measurement immediately before and immediately after, like we would say, oh yeah, we probably the two groups, one that ate the cake, one that didn't. We can imagine that the one that didn't eat the cake, like within that hour, is a pretty good counterfactual for in every other aspect except for the cake part or something. So if it's really close together, right, then the plausibility of the assumptions can be quite high. To really torture this cake analogy, like if instead, like I looked at the two groups, the one that had the cake and one didn't, but like a month before they had the cake and like a month after, and I said like, oh, well, what's the difference in the two groups? Like, oh, the change over time. Well, then that's kind of implausible that the change would, be identical, because probably people are eating different things anyway, and so they'd have different trends. So a little bit similar when we think about poverty analysis programs, where, if we have years and years that pass, sometimes, especially when we look at large, regional averages or something like that, like district level averages, right? It might be tough to kind of justify this parallel trend assumption, right? Especially if we know there's shocks that are happening. We know, oh, there was a flood in some areas and not others. We might actually, verify that, yeah, this assumption doesn't hold. If you notice in the picture here, visually, the authors have done a little clever thing by showing, like, actually, in fact, what's really great is when we have multiple pre-programmed data points. And we can show that, oh, actually, over many years, yeah, the two groups were different, but their outcomes changed in parallel to each other. And then the program happened and no longer were the trends parallel. Well, that's actually a pretty nice way of showing, not sufficient condition, but it's a nice kind of consistent with the assumption of parallel trends. When I say it's not sufficient, like there really is actually no observable sufficient condition for parallel trends assumption. Because we can never observe the counterfactual outcome or the counterfactual change, it's always an assumption. I'm going to just skip this little kind of example about the 2-by-2 case by just saying that we can do this difference in differences, and why I say it's very general and something that we should you can kind of think about is this generalizes beyond just this 2x2 case and a very particular program intervention, right? In particular, right, when we look at like multiple districts or geographic areas or GNs or divisions where where a policy might happen and it might be implemented at one point in time and then at another point in time, and kind of they have these staggered designs, right, that oftentimes happens in actual policy making where some districts might adopt a policy and some don't. There might be a rollout of some kind of government program to some areas and not others, and it's not random, right? But we know we have baseline data and we have end-line data. Well, this is when we can actually utilize this same kind of framework, right? To essentially look at these changes over time as these kind of policies get turned on and off. And so oftentimes these are called kind of natural experiments or natural policy experiments. They kind of utilize this difference in difference framework. And I want to make a special point, which is in the last couple of years, there has been kind of an explosion in the methodological literature, both showing that a lot of the way we used to do this stuff has some problems when we have staggered treatments, but often, but kind of in a helpful way, not just criticizing, but also proposing some good solutions for these issues, where the idea being essentially that when we make these comparisons, we're not accidentally comparing like early adopters to late adopters and things like that. We're actually comparing the groups that we want to compare. So there is a good methodological literature on this stuff, and it's not hard to implement. So basically, you know, when we're thinking about policies and policy evaluation, right, using especially geographic, spatial, and temporal variation and when these policies occurred or affected people. And if we have data from kind of the before and after at different points in time, right, we can actually do a pretty good job at using differences and differences to kind of give causal impacts of those policy changes. So in the US, like we have 50 states. And this is like often like how many differences and difference papers are written by some states did this and some states didn't, and over different points in time. And we look at kind of differences between them. And, you know, here we have what, 25 districts. So not as many, but we often, you know, there might be probably a little less federalism that goes on, but I'm not sure, but different policy, you know, timing of implementation might differ, but it does give a kind of scope for doing some of this kind of analysis. A variation on this is called synthetic control design, which is essentially a similar idea behind difference and difference, kind of like a difference and difference combined with extreme matching, when you have one place, typically a case where you have one place that has the policy and a lot of places that don't. And essentially you kind of make a, like, okay, if it's in Kurunagala district had the policy, how do we make 24 districts combined to be one synthetic Kurunagala? Like we reweight all the districts in Sri Lanka and kind of use that as the counterfactual change. So there are different ways of approaching these kinds of issues. The last one I'll mention is just regression discontinuity. Regression discontinuity is the idea of, and it's always accompanied by pretty pictures that look like this. And the idea is like, okay, we're seeing there's some kind of line in the middle and some kind of break. And that's exactly what we're thinking about. The idea is, all right, again, we have this treatment that happened, this program happened, it was implemented. The two groups that got it are definitely not the same. We can't make our random average, on average, identical assumption. But what if the determination of who got the program, this eligibility cutoff, right, is such that people that just made it and just didn't are basically the same. So we can't say the whole group that got the program and didn't is on average the same, but just the people around the threshold. We can say if you're landed on the right, the eligible or ineligible side, you would just be it would just be basically the same. We can make the program would be as if it was random. I'll just give an example of this because this was a very early application in the US context, but I think would be highly relevant for Sri Lanka. When we think about educational policy and the kind of higher education in particular and examination systems, right? Extremely cutoff sensitive, right? If you get your A-level Z-scores, right, by a knife edge, you could either like end up like in a medical faculty in Colombo or like, you know, the agricultural school in, Rohuna or something like that. So different, like, highly competitive. A lot of people get really scores. So the differences are very small, separating people that essentially get into higher education, get into the university system and don't, right? Or people that just make it, forgetting a medical faculty, like, just make it into the national universities or just don't, right? And so if we wanted to think about, well, what's the impact of that on people's lives and livelihood and income, right? People spend all this money on tuition payments and like essentially huge investments in order to get on that one side of the cutoff, right? Well, we think about like, what are the outcomes there? This would be the kind of, a natural application of RDD, because we can imagine if we look at the top student at getting into the medical faculties at Paradini in Colombo, and like the last Z-score in at a different university, right? Those students are going to be different on average. We can't really say much about like the last student that like the worst performer on the exam, not on the A levels, and the top performer, right? But like the one that got, the difference of having like one question wrong on an exam, like, or living in a district where the Z-score was slightly higher, right? I mean, are these two people really different? We could make the argument that their counterfactual outcomes would probably be the same or very similar on average. And so essentially, though, that in an early RDD paper in the US was explaining the SAT scores exam for getting into a university, right? So looking at a highly selective like Ivy League school versus not. And actually the kind of appropriateness of the approach would probably be better here, but it's not just with scores, exam scores. We can look at, for example, we're talking now with a program that kind of use age eligibility thresholds, right? Like date of birth for children for like a nutrition cash transfer program. Well, is there a big difference between a kid who's like 6 months versus 5 months and 30 days old? Right? Like not a huge difference. Obviously, we can't compare like 1-month-olds and 11-month-olds, right? But right, families with a 1-month-old, 11-month-old, but families with like a 5-month-old, 25-day, 5-month and 25-day-old versus 6-month-old and 1-day-old, like those probably are going to be pretty similar, right? So we can think about doing this in other ways, other scores that get developed, right, for eligibility. Classic things is these asset score indexes for poverty programs, right, where people are ranked and there's a cutoff, right? Well, people just around, quite close on these scores usually are pretty similar, and again, we can compare their outcomes. There's some practical stuff with this. We have to actually have data on both sides of the cutoff. This is oftentimes a challenge, right? Because like, oh yeah, the program implementer they'll tell you what happened with the people that they know, they'll never have anything to do with the people that didn't make it. Like, so sometimes we have to, the data issues are become a challenge, but and there's also you can do this retrospectively, but also prospectively, saying like, okay, if you're going to make a cutoff, instead of making it like this kind of round number that people might be able to sort into, what if it's like an arbitrary number that's kind of like, in the middle? So making it slightly more amenable to this kind of RDD is also potentially useful. So I think in terms of the technical stuff, that's all I really wanted to cover. I probably went a little longer. And I did, obviously wanted to talk about some potential design issues, things that like come up, any like policy evaluation type of questions, things that are kind of interest right now, things that might be implemented, So yeah, I wanted to make sure we had time for that.
So thank you very much, Dr. Schwab, for coming here today and, sharing experience with us. So we'll just continue the conversation with a little bit about future SEPA program. So thanks for joining. Thank you very much.